Welcome, and thanks for joining me for part 2 of this shocking and informative program on brain death and organ donation. During our last episode, we discovered there's been an increase in brain death diagnoses over the past several years, and we learned about the subjective criteria used to make these diagnoses. We also learned how medical professionals can be financially motivated to make a quick diagnosis. Today, you'll hear about the alarming realities of the organ procurement and donation process. Don't miss it, because a future life may depend upon it. Angela Clemente spent 20 years working in the medical field in the pathological and clinic lab and the ER. She spent the past 17 years as a paralegal and forensic intelligence analyst. Her findings have been cited during multiple congressional investigations, including the Jahai McMath case. Several years ago, Angela's mom was hospitalized and diagnosed with endocarditis, an infection of the heart. The hospital chose to medically manage instead of aggressively treat her mother. As her mom's health steadily declined, Angela and her brother were called into a meeting with the hospital ethics committee.
They told us, well, they're in here to help you guys understand what's going on and to make things work better for, between the hospital and you guys. And I said, okay. So I'm thinking, oh, great. It's somebody that's going to negotiate and listen to what we have to say. That is not what an ethics committee is for. That is not their agenda. We'd started having a bombardment of nurses and doctors and internists coming in and asking, do you really want your mother in pain like this? You know that she's suffering. She's suffering like this. She's suffering. Would she really want to be on a respirator and trying to do this guilt type of intimidation? I did not know that if there's a conflict, if you have, say, 2 other brothers, if one of them, and a lot of people don't know this, this is key and very, very important for families to know. If even one of them is not in agreement and thinks, well, maybe she's suffering, maybe we should let them go, that is instant. That's all they need to hear, and then legally, they can take over. If your mother or father, if they don't have something in place saying who's going to act on their behalf, then, and the family does not all say the exact same thing, ethics committee can step in and take over. Then you're done. The family has no more say-so. Luckily, me and my brother were in agreement at all times. We knew that Mom wanted to live.
Angela's mother slipped into a coma, and the hospital pushed to diagnose her brain dead. But Angela took steps to advocate for her mother's wishes. She called in a doctor and personal friend for a second opinion. He believed her mother was not brain dead, but that her ammonia levels were too high due to the narcotics, causing the coma and low brain activity. Angela also received word from a friend at the hospital who knew her mother wasn't being cared for properly.
She said, I walked in when they were changing your mother. Your mother has a decubitus ulcer, a big bed sore, in other words, on her sacral area, the butt bone there, the size of a dinner plate, and it's down to the bone with the muscle and bone exposed. So I called in Adult Protective Services. I noticed they're pushing me on signing off on her last 60 days, lifetime reserve days. These are something that Medicare has. When you run out of your Medicare money and you have nothing left, there is a little reserve there called the 60 lifetime reserve days, and you get 60 days of full treatment. They just took it without me signing off on it. They took the 60 lifetime reserve days. I called up Medicare and I said, we've got some fraud going on. They took my mother's 60 lifetime reserve days, and according to you guys, they can't take that without my signature or without my brother's signature. They said, really? So they started their own investigation.
The hospital gave Angela 8 days to move her mother, and on the 3rd day of that period, her mother woke up. She was cognizant and reported hearing the conversations about her brain death diagnosis.
She woke up. Medicare fraud had stepped in. We got her transferred to the Mayo Clinic up in Jacksonville. She survived. The hospital had to give back $236,000 back to her lifetime reserve days.
Coming up, we'll hear surprising truths about the organ donation process. Teresa Dampf is a former EMT driver and has been working as an ER and ICU nurse since 1998. She has witnessed how aggressive organ procurement teams can be at convincing families to agree to organ harvesting. One situation in particular involved a young girl named Jasmine. After her pancreatic surgery, her liver was damaged by an overdose of acetaminophen. Her brain swelled and she was declared brain dead. Jasmine was an organ donor, and the procurement team quickly stepped in and started pressuring her mom, Anna, for organ harvesting. But Anna wanted to give Jasmine time to possibly heal, and she didn't want to be pushed unless Jasmine was truly dead.
They were watching to see when all her support system had left, and they were going to turn around, and if they could have gotten her to break and say, okay, do what you want to do, I believe they would have set up the operating room team and they would have taken that girl out of the room.
And harvested her organs.
Yes, yes. That evening, another doctor who was actually one of Jasmine's personal doctors, he came into the room after a whole day of surgery, and he basically said, you know, Jasmine signed a donor card. And her wishes were that when she died, that she would donate her organs. And I looked at him and I said, yes, but doctor, when she signed that donor card, was it informed consent? When she signed the donor card, was her definition of death and organ donation the same as yours? Well, her family understood organ donation, giving your organs after death would be that she's removed from the ventilator, she stops breathing, her heart stops, they say their goodbyes, and then you are allowed to take her and take her organs. And the doctor looked at me and he said, well, he goes, then her organs would be useless. Nobody does that. And I said, you know that, and I know that, but I said, she didn't know that when she signed that card. I started asking friends and family, and I mean, I'm saying people with college degrees and very well-educated individuals, what did they understand about donating organs after you're dead? Many, if not most, did not understand that they are taking you breathing with your blood pumping, with everything functioning, and then they cut out your organs.
Dr. Paul Byrne practiced medicine as a neonatologist and pediatrician for 55 years. He's currently the president of the Life Guardian Foundation and works to inform people about the troubling diagnosis of brain death. Throughout his career, he has seen an increase of the diagnosis as a means for organ transplantation, and he fears not enough people are aware organs must be harvested from a donor with a beating heart.
Brain death, of course, was invented. They had started to do heart transplants, but they realized that they were not successful unless they got a living donor. Every heart that is transplanted is a beating heart that is stopped first and then taken out for transplantation. The heart without oxygen in 4 to 5 minutes is so damaged that you can't transplant it. The liver, likewise, in 4 to 5 minutes is so damaged that you can't transplant it. So they have to get these organs while they have circulation.
Would you say that most people think that the organs are harvested in the hour or so after the person officially dies?
Of course. Who would think that they would be taking organs from a living person? It's written on our hearts to protect and preserve not only our own life, but the life of people that we love.
What do you think is the incentive of the hospital to declare somebody brain dead so that they can harvest their organs?
Financial. I have to have a transplant. I'm waiting for a transplant. I'm ill. I have a liver issue that If I don't have one, I'll die. Just my surgery alone, I've already been quoted $500,000 just for the liver. So can you imagine if they get a patient's body that gives the corneas, gives a heart, gives a lung, and they don't give the patients time enough? It's generally around 3 days, unless the family fights it. They want those organs within 3 days. EMTs know that they're directed, when there's a brain injury or a head injury, they're directed to the trauma centers. The trauma centers have a little thing going with the procurement centers, and the procurement centers will know that patient, that they're going to declare that patient brain dead before the family knows that they've declared them brain dead. And so they will come in sometimes before the family's even been talked to about that and ask if they would give the organs of their family members.
In a moment, we'll learn how you can opt out of being an organ donor. Based upon the need to harvest organs from a person with a beating heart, many people are choosing to opt out of being an organ donor, but their refusal must be documented. Dr. Paul Byrne and the Life Guardian Foundation are working to educate people about this option and are providing the necessary documentation.
If you have once signed up to be an organ donor at the License Bureau, say, you can go to the License Bureau and get a revocation of that. The law, the Uniform Anatomical Gift Act, is written in 48 states that says a revocation is not a refusal, and they can still get your organs. You must have a document of refusal, is the way the law is written. So we have cards that we give out that says that you want to be treated, but you don't want to be an organ donor. Also says don't let them do an apnea test. So I encourage you to get the cards, sign them, witness them, and date them, and carry them with you. Then you have a chance.
What advice would you have for someone who's currently a registered organ donor?
Even if every organ of mine was healthy, I will not be an organ donor.
Why?
Because I think that they would, I know that they would exacerbate your condition if you come into the emergency room or have a problem or a medical issue.
Just to get your organs?
To get the organs.
Bobby Schindler is the brother of Terri Schiavo and the president of the Terri Schiavo Life and Hope Network. While Bobby believes in the good that can come from organ donation, he also cautions people to educate themselves and challenge the brain death diagnosis.
I think they need to do their diligence or due diligence and educate themselves on this whole organ donation program. I think it can be a good thing, so to speak, but I think it's been corrupted. There are situations where a person can use the organ donation program to help. It can be helpful, but I think people have to be very careful and really do their best to educate themselves on whether or not they want to be an organ donor.
Jenny Hammond was a registered nurse for 12 years. In 1985, after a series of seizures, Jenny fell into a coma and was declared brain dead. Her husband refused organ harvesting for Jenny, and she woke up 3 weeks later. As the former executive director of California Nurses for Ethical Standards, Jenny has seen many cases where doctors and organ procurement teams make decisions that don't necessarily align with their oath to do no harm. Jenny, how does a brain death diagnosis for organ donation align with a physician's oath of do no harm?
It's in very poor alignment because they're not looking at doing no harm to this one specific patient. They're looking at deliberately harming one patient for the benefit of another patient, and we're not supposed to do that. With limited resources, we might have to sometimes in triage choose who gets the resources, but at no point should we deliberately harm another person for another one's benefit.
Would you say the physician is intentionally, deliberately harming that patient? or?
In some cases. In my case, I believe that yes, the physician was deliberately looking to harm me for some sort of benefit. I think that he knew that my coma was drug-induced, and he was taking advantage of that as an opportunity to procure organs.
Through the work that you've seen with Terri's network, have you seen a trend in the medical community where they're turning more away from valuing human life and preserving it to instead ending it?
Without a doubt. It seems to me decisions are being made with what is in the best interest of the hospital rather than what is in the best interest of the patient. So every day we're seeing it more and more where patients' medical rights and families that are advocating or trying to protect their loved ones are being eroded more and more every day. And there's been a shift where these hospitals, these ethics committees, these doctors are now in position or have the power, so to speak, to make medical determinations and whether or not a person is going to receive these types of treatments rather than family members. So you have strangers now making decisions where families once were making decisions with what was in the best interest of the patient or their loved ones.
How can a family challenge a diagnosis of brain death?
There's a couple things that they can do. A couple things that they should not allow to happen. One is they'll ask them to sign for an apnea test. The apnea test is to see if they can breathe on their own after a certain amount of time. It's going to be within those first 3 days. So that brain has not had the time to heal, and because of that, they know that apnea test is going to come back very poorly. Also, the apnea test can cause more brain damage. Don't sign off on the hospital's advance directives. Get your own, have an attorney. Put in there that you reject the brain death diagnosis. So when you enter a hospital and you have those documents, or someone, your family has those documents for you, they know right off the bat you're rejecting that. And you're not going to allow them to do some of those tests that are going to damage the brain worse.
When we return, we'll learn practical ways families and medical professionals can advocate for patients facing a brain death diagnosis. Bobby Schindler and the Terri Schiavo Life and Hope Network are working to provide practical help for families who are dealing with the trauma brain death diagnosis spring. This is a life and death issue plaguing patients across the country. Families and medical professionals have the authority to advocate for loved ones and ensure that every person is valued and given the best chance for treatment and recovery.
We've been in existence now for over 10 years, and during that time, we have just a huge network of resources. So we have physicians, we have attorneys, wherever the person might be throughout the United States. We've been very successful in finding them the help that they need.
How can medical professionals and family members be advocates for patients?
Well, they have to know their rights. Many times these families or whoever it is advocating for loved ones don't know their rights and the things that they can ask for, certain types of treatments that they have every right to provide for whatever it is the situation might be with their loved one.
Give your family member time and reject the brain death diagnosis immediately. Get some help. Try to get some help. Go to Terri Schiavo. Come to me. Come to Life Legal Defense. Go to people that can help.
As a nurse, how can medical professionals and family members advocate for patients?
We first have to build a relationship with the patients and their families, because nurses are the most trusted profession out there. And without that relationship and the trust, we can have no influence whatsoever or have a negative influence. So if we want to have a positive influence, first we have to build the relationship. Second, we have to be honest, even when it's risky for us to be honest. And it is risky.
Well, we're seeing this whole quality of life mentality, I think, permeate our healthcare system today. Decisions are being made that are in the best interest of the hospital's bottom line, rather than what's in the best interest of the patient. We've been involved in cases where, and know of cases, that if a person is just given time and given a chance at rehabilitation or therapy or something, does improve, and does improve significantly. When someone experiences a profound brain injury, it doesn't have to be a death sentence. We have to do what we can to change that paradigm and get people to understand that these people, more than anything, need ongoing and constant rehabilitation and therapy. We saw in my sister's case, where they were saying, well, no rehabilitation is going to help her. There's no therapy that was going to improve Terri's condition, which is completely contrary to all the evidence that's coming out now when it comes to people with these types of brain injuries, like similar to Terri's. So people need to educate themselves. They need to learn more about brain injuries and how these people can be so helpful to us to learn more how to not only treat people with these types of brain injuries, but to also care, love them, and show the compassion they deserve.
These special programs on end-of-life issues challenges the conventional medical wisdom on the way the patient is treated. It's hard to argue with the personal experiences of my guests. Perhaps if more people had this information, more patients would be alive today. Please visit facinglife.tv for additional resources and information. Thanks for watching. For more resources to better inform you about brain death and organ donation, visit our website at facinglife.tv. While there, find out how you can order a copy of this special 2-part episode on DVD and Blu-ray to share with others.